Hello guys, this is Dr. Ratisham, and in today's video I'm going to talk about a very high yield topic for so many exams for step 1, Plab and so many other exams, and I've seen a lot of MCQs coming from this topic in the U world. So this is extremely high yield topic, but most of the students find it very difficult, and it's very difficult to solve the MCQs related to this topic. So I showed you that after watching this video you will have a proper command on this topic, and you will remember all the hormones, all the enzymes, all the substrate in this pathway. Like, you will not forget even a single thing. So I have an extremely easy way and some good mnemonic that will long last in your memory. So let's start. But to understand this topic properly, there are few concepts you have to understand first, and that are also very easy. So let's first talk about this concept. So the first concept is that, like, all these steroid hormone, aldosterone, cortisol, androgen, are synthesized from the cholesterol. Cholesterol give rise all of these three. Aldosterone is prepared in the zona glomerulosa, and cortisol is prepared in the zona fasciculosa, and androgen in the zona reticulosa, and all of these are synthesized in the adrenal cortex. When their level rise, they just have a negative impact on the ACTH. When their level decrease, ACTH increase, and they basically convert the aldosterone, cortisol into these things. This is the second concept that is related to the previous slide, and androgen, that is a male hormones, but it's also present in the female as well. So this is another core concept. Like, when you have the excess androgen in the male, remember, androgen are the male hormones. So when you have the excess of the male hormones, your puberty will come earlier, precocious puberty. When you have the excess androgen hormone in the female, what will happen to the females? It will make the female more like a male. Like, she will have virilization, she will have ambiguous genitalia, she will have a genitalia like a male, and she will have virilization, she will have axillary hair, she will have earlier puberty hair, she will have facial hair. Similarly, when you have decreased androgen hormone in the male, when the decreased androgen hormone in the males means ambiguous genitalia, his genitalia will look more like a female. When you have the decreased androgen in the female is normal, because androgen are not the female hormone, they are mainly the male hormone. But still, some amount of the androgen are required in the female, because some of the testosterone are converted to the estrogen, and that is necessary for the secondary sexual character. So the female might have lack of secondary sexual character. So these are the core concepts before starting the pathway. So just to understand the pathway and remember it, we have a very good and easy mnemonic. So the mnemonic start is: when a female get pregnant, her progesterone level increase. When her progesterone level increase, she start feeling some body changes, and then she come to doctor for the checkup. So this is going to be our mnemonic, and this will help you to remember all the substrate in the pathway. So when a female get pregnant, so from the pregnant you will remember pregnenolones. Her progesterone level increase, so then the second hormone is the progesterone. Then she come to a doctor. So here is 11 deoxy doctors, deoxycortisones, and then deoxycortisone is converted to a two simple substrate, that is corticosterones and aldosterone. Similarly, at this sides, again the same name, just 17 hydroxy before the name. So you have 17 hydroxy pregnenolone, you will have 17 hydroxy progesterone, 11 decortisols, and cortisol. So this pathway, I have this mnemonic will help you to remember this pathway. Like, when you get pregnant, your progesterone level increase, then you come to the doctors. So same on this side, just add 17 hydroxy to the names. Now, what are the hormones that are driving these reactions? Like, what are the hormones that drive these reactions, that drive this reaction, that drive this reaction, or all these reactions? So there is another easiest way just to remember all these hormones. And when you remember these hormones, the deficiency of any of these hormones will help you remember, like, what will happen to the patients, what will be the signs symptoms in the patients, what will be about her genitalia. So all these things are going to be super easy for you. So what is this 3-2-1? Like, the easy way to understand this concept is to learn the 3-2-1. Same on this side, 3-2-1. So this, what is this 3-2-1? This 3-2-1 is 3 hydroxylase, 21 hydroxylase. You have just add 1 to the 2, and here is 11 hydroxylase. Same on this side, 11 hydroxylase, 21 hydroxylase, and 3 hydroxylase. Okay, so I hope this basically help you in remembering the hormones. Okay, now discuss another very important hormone in this pathway, that is 17 hydroxylase. Like, pregnenolone is converted to 17 hydroxypregnenolone by 17 hydroxylase. Similarly, progesterone is converted into 17 hydroxyprogesterone by 17 hydroxylase. So after discussing all these hormones, 3 hydroxylase, 21 hydroxylase, 3 beta hydroxylase, 21 hydroxylase, 11 hydroxylase on the both side, and 17 hydroxylase. Now let's discuss some of the disease, some of the condition related to a deficiency of these hormones. So now let's start with the deficiency of the 21 hydroxylase. So let's suppose we have the deficiency of 21 hydroxylase. What will happen to the patients? So when you have the deficiency of the 21 hydroxylase, you will have decreased synthesis of the aldosterone, you will have decreased synthesis of the corticosterone. So remember, when you have decreased the deficiency of both of these substances, the patient will have the sign and symptoms related to a deficiency of the aldosterone and the corticosterone. So what will happen to the patient genitalia, and what will happen? So when you have decreased deficiency of these substances, definitely your ACTH level will increase. When your ACTH level will increase, they will start acting on the cholesterol. So again, the cholesterol will convert it to progenolone, as the progesterone cannot be further converted into both of these substances due to a deficiency of 21 hydroxylase deficiency. So what will happen? It will start just taking this pathway. It will start converting to the 17 hydroxyprogenolones, 17 hydroxyprogesterone, and both of these will start converting to this substance, and there will be increased synthesis of this side of the hormone. So you will have increased androgens, you will have increased androgen hormone. And as I discussed on the previous slide, when you have the increased androgen, excess androgen, so if this patient is the male, he will have the precocious puberty, but if this patient will be the female, she will have virilization and she will have ambiguous genitalia. So I hope this help you. Let's discuss deficiency of 11 hydroxylase. When you have the deficiency of 11 hydroxylase, again you will have the deficiency of both of these hormones, aldosterone, corticosterone. But remember, when you have deficiency of these hormones on this pathway, on this side, there will be increase of the 11-deoxycorticosterone, and this 11-deoxycorticosterone has exactly the same properties that aldosterone has. So usually the patient will have the sign and symptom related to a deficiency of the corticosterol, not the deficiency of the aldosterone. Though the patient will have the deficiency of aldosterone, but they will not develop the symptoms of the aldosterone deficiency related, just because this 11-deoxycorticosterone has the properties like the aldosterone. And again, this pathway will start converting. Again, there will be due to deficiency of both of these substances, there will be increased ACTH secretion. Increased ACTH secretion will act on the cholesterol, and this pathway will again take starting this way, increase androgen synthesis, and again when increase androgen synthesis, and so you will have the excess androgen. So if this patient is a male, he will have precocious puberty. If this patient is a female, she will have virilization or ambiguous genitalia. So far we have just covered these two pathways, like the deficiency of the 21 hydroxylase deficiency, deficiency of the 11 hydroxylase deficiency. So now another thing, that is the deficiency of 17 hydroxylase. So what will happen if the patient is having the deficiency of 17 hydroxylase? When you have the deficiency of 17 hydroxylase, you will have decreased synthesis of the corticosterones, you will have decreased synthesis of the androgens, and you will have increased synthesis of the aldosterone. So now the patient will have the sign symptom related to the aldosterone axis, he will have the sign symptom related to a cortisol deficiency and androgen deficiency. So now in the deficiency of 17 hydroxylase, the patient will have decreased androgen. When you have decreased androgen, and if this patient is a male, so decreased male hormone in the male, what will happen to the male? The male will have ambiguous genitalia, because these hormones are necessary for the proper development and for the proper development of external genitalia. And when this patient is a female and she is having decreased androgen, so what will happen to the female? She will be either normal or she will have decreased she will have lack of secondary sexual character. And why this lack of secondary sexual character? Just because in the female, testosterone basically convert into estrogen, and this estrogen is necessary for the development of the secondary sexual characters. So deficiency of the 17 hydroxylase will shut down these two pathways. They will have decreased cortisol, they will have decreased androgens, and they will have increased aldosterone. So there is another hormone 1720 lyase that convert the substrate of this side into this side. So now how to remember the substrate of this side? So the easy mnemonic for this is DATE. U date and then U6. So you have DHEA, you have androstenedione, you have testosterone, and at the ends in the female and male, both of these are converted into estradiol and estrone. So aromatase is the main enzymes and that convert these reactions, that drive this reaction. This pathway, aromatase, is the main enzymes that drive this reaction. They convert androstenedione into the estrone, that is a kind of estrogen. And similarly, the testosterone can be converted into the estradiol, that is another kind of estrogen. And both of these reactions are driven by the aromatase. So I also have another good mnemonic to remember the aromatase inhibitor, because there are so many MCQs in the step 1 exam related from these hormone inhibitors. So we have aroma. Aroma is a girl name. They are having the exam. So aroma, let's try zoo in the exam. So aromatase, aroma will remember you. Aromatase, let's try zoo. Letrozoles. Let's try zoo. Letrozole. In the exam time. So this will remember you the aromatase inhibitors, and you have to remember this thing because so many MCQs in the step 1 from this path. Okay. So now there is another very important test related to this pathway. That is metyrosine suppression test, and this is a test that is used to check the integrity of HPA axis. So in this test, you basically give the metyrapine to the patient, and it block the 11 hydroxylase. When it block the 11 hydroxylase, basically the aldosterone and cortisol synthesis decrease. As a result, there will be increased ACTH. When there is increased ACTH, there will be increased conversion of the cholesterol to all these substances, and the pathway will come all the way to this, but they cannot. But from here onward, they cannot be further converted into aldosterone and a corticosterone. So you will have the increased 11-deoxycorticosterone. You will have increased, say, 11-deoxycortisol, and when you have this increase in this hormones, this will be converted into 17-hydroxysterone. And there was an MCQs in the U word, like you gave metyrapine to the patient, there is increase in the 17 hydroxycorticosterone. So what is the main mechanism behind this? There, the main reason behind this thing is the ACTH surge, because when you give this block this hormone 11 hydroxylase, blocking this 11 hydroxylase result into deficiency of both of these hormones, and this will basically increase the ACTH. ACTH will act on the cholesterol, and the cholesterol will then be driven all the way into this substance, and then the 11-deoxycorticosterol will be converted into 17 hydrocorticosterone, and that will be excreted in the urine. So this is the test that is basically used to check the integrity of this HPA axis. So I hope you have understand all the concepts, you have understand all the substrate, all the hormones, and all the disease related to this pathway. And please like, subscribe, and comment on my channels.